Hello, my name is Dr. Daniel Kantor, and I'm the Medical Director of Neurologique, an organization dedicated to patient-centered care, research, and education. I'm also the president of the Florida Society of Neurology and a member of the Healthcare Advisory Panel of the MS Foundation. We know that it's an exciting time in multiple sclerosis in terms of the explosion of the number of medications that we see being used to treat relapsing forms of multiple sclerosis. There are ongoing trials of progressive multiple sclerosis, but we're also learning more about what we call clinically isolated syndrome, or CIS, which is really the first clinical event that we think later can go on to become multiple sclerosis. What we learned in the past was that using the self-administered, self-injectable medications such as the beta interferons as well as glatiramer acetate, also called Copaxone, is that we can delay the progression to multiple sclerosis from clinically isolated syndrome. Today I had the unique opportunity to have a phone conversation with Dr. Erin Miller, who is the medical director of the Corinne Goldsmith Dickinson Center for Multiple Sclerosis at the Mount Sinai Medical Center. Dr. Miller and I discussed the findings of a trial called TOPIC. TOPIC is a trial looking at an oral medication known as Teriflunomide or Aubagio, given in one of two doses, either 7 milligrams or 14 milligrams, once daily by mouth, so no injection, and it can be taken with or without food. This medication has already been approved by the FDA for relapsing forms of multiple sclerosis back on September 12th of 2012. The TOPIC trial looked throughout the world at patients who have what we call clinically isolated syndrome, meaning that first time attack of what we think will become multiple sclerosis. And patients also had to have at least two T2 hyperintensities. T2 hyperintensities are basically the white spots that we see that are consistent with multiple sclerosis. So in this trial, we took people who are at risk for developing multiple sclerosis and we saw whether treating them with the medication could delay that amount of time until they get diagnosed. So delay that second event that they have. Interestingly, the TOPIC trial was a positive trial, meaning that for the people treated with 14 milligrams of Aubagio once daily, what we saw was a 43% reduction in them progressing to have a second attack during the trial, meaning that people had one attack and then weren't later diagnosed with multiple sclerosis during the trial because of the medication. When patients were treated with 7 milligrams, so at the lower dose, we also saw that delay in their diagnosis to multiple sclerosis, but what we saw was about a 37% reduction. So this means that being treated versus not being treated not only can help people with multiple sclerosis, but can help people even very early on. Even before the diagnosis of multiple sclerosis is made, it can delay the time until someone develops or gets diagnosed with multiple sclerosis. I asked Dr. Miller what he thinks the main takeaway points that you at home should take back with you. And he said that there were three things. The first thing that he thought was important to realize was that this trial looked consistent with what we've seen with the self-injectable medications. We've seen similar trials that have happened with the beta interferon, so we've seen it now with Avenix, Betaseron, as well as Rebif. And we've also seen it with Copaxone, that when you treat early, you can delay the amount of time it takes until someone gets diagnosed with multiple sclerosis. The second thing that he wants everyone to take back with them is that we know once again that early treatment is better than later treatment. And what we're learning is that the earlier you treat, really the better it can be. So even before a definitive diagnosis of multiple sclerosis can be made, we think that it's important to go ahead and to start treatment as well. Dr. Miller also wanted everyone to take back with them that what we saw was consistent with the other trials that we've seen for Aubagio. We've seen now a trial called TEMSO, as well as a trial called TOWER, and those trials looked at relapsing forms of multiple sclerosis, not just relapsing remitting, mostly relapsing remitting, but also secondary progressive MS with relapses, as well as progressive relapsing. And in there, what we saw is a reduction in the annualized relapse rate, so the number of relapses people were having per year, as well as a reduction in the MRI lesions that we saw, so the white spots on MRI, as well as a reduction in people who progressed to disability. Now, all we have so far are what we call the top-line results of TOPIC, meaning that we don't have all the results yet, and we're going to hear more and more in the upcoming months, but we're going to hear a lot more about it at ECTRIMS. And ECTRIMS, remember, is the European Committee on the Treatment and Research in MS. This is a meeting that I go to every year and that I can broadcast to you in real time along with MS World. So please, I hope to see you there, and I hope to see you even beforehand at the Consortium of MS Centers. Thank you so much for joining us today.